Hello, everyone, and welcome back to the Injury Podcast. I'm your host, Dr. Craig Salinger, chiropractic physician. I have a great episode today. We're going to be talking about something that is a very frustrating injury because it's something that you can't always see objectively. And I have a guest here who I know for some time. He is a chiropractor, and before I go into the show, I just want a quick disclaimer. This this show is for educational purposes only. It does not constitute a doctor-patient relationship. We're going to be providing great information that is going to help people that have different injuries. So today I have a guest on, Dr. Mark Slater. He is a chiropractor. How you doing, Mark?
Great, Craig. Thanks for having me.
Awesome. And we're going to be talking about concussions, also known as traumatic brain injury. It's confusing for a lot of people, Mark. Dr. Slater, we hear of a lot of people that have concussions, brain injuries, and then what ends up happening is they go to the hospital after an accident. They have a CT scan. They have which is a CAT scan. They have an MRI, and they're told in the hospital that everything is fine. But weeks later, they have headaches, brain fog, disorientation. They're not performing well at work. They're not sleeping well. So I know that you have a lot of experience with teaching people, teaching chiropractors and medical doctors, and having a forum where you help chiropractors understand this misunderstood topic. So how do we, first of all, what is a TBI and what's a concussion? What is this?
Right. Well, I mean, it stands for traumatic brain injury, right? You hear this in professional sports, car accidents. People get their head rocked around like this little ball of jello inside your skull can get moved around and can cause injury. And for years, concussion diagnosis was mostly heavily subjective, on subjective complaints of the patient, right? Headaches, irritability, can't sleep. But that's just not enough anymore, especially, in my ecosystem, I'm in the personal injury space. So a lot of my stuff is going to be tailored toward building a personal injury case if a patient does have a documented brain injury, but those subjective complaints are just not enough. And in 2025, May of 2025, the Lancet Medical Journal came up with a new framework. They called it the 4 pillars, the CBIM framework. And we're going to get into this on this call. But CBIM stands for clinical, biomarkers, imaging, and modifiers. And we'll go into each one of those. But now there's advanced imaging, shifting from opinion-based medicine to data-driven medicine, right? Because in personal injury, you need objective evidence, not just what the patient says, my neck hurts, I have a neck sprain, back pain, headaches. We need objective evidence, especially in a personal injury case, to prove causation and document the injury objectively. So the NIH has moved into a more sophisticated model, the CBIM framework, which we're going to talk about here. And it stands for clinical, biomarkers, imaging, and modifiers. And it's a 4-pillar approach that reflects how medicine has evolved in recognizing brain injury.
Okay, so let's unpack this a little bit because there might be some listeners out there that are not familiar with all these terms. When we talk about objective findings, that is something that universally everyone can see. When we're talking about non-objective findings, they might be things like symptoms. So objective findings can be an X-ray. You see a fracture on an X-ray, for instance, in an example. So with one of the challenges with concussion, TBI, because it's interchangeable, is that for years there haven't been very good objective findings, meaning somebody could have an injury, but we can't see it. We can't measure it. It's there, but it's not positive. It doesn't show up on MRI. It doesn't show up on a CT scan. It doesn't show up in blood work. In the past, that was the way that, unfortunately, there wasn't these measures that we were able to.
The technology wasn't there.
The technology wasn't there. And so now there are these changes, and the work is becoming more sophisticated, and there are new technologies, and there are better ways to actually diagnose, find out if somebody had a concussion, and also the severity. So the other thing is, just to let the audience know, I know Dr. Slater because he is a coach. He coaches chiropractors and physicians about injury. And I had been a client of his. He has a mastermind group where people meet at different times of the year, and we had speakers, people that were from different fields, talking about injury and latest cutting edge technologies to identify an injury, and then also treatments, some new treatments. It was a great group where I learned a lot. And from that, I had one of them to come on today because he is an authority, and he has these groups where it provides a lot of information. So if you are a chiropractor out there and you're listening, I do highly recommend checking out his group, and we're going to have some information about that later on in the podcast. But let's jump back in to this. So what are some of these new classifications that you were talking about?
Sure. Well, let's just talk about a brain injury for a second, because even if you don't lose consciousness after an injury, a car accident, or you hit your head, it doesn't necessarily mean you did not have a TBI. The symptoms can be delayed. I mean, this is happening at a microneuron level, right? Mm-hmm. So let's talk about the 4-pillar framework that the NIH came up with, National Institutes for Health. The first one is clinical, right? And by the way, just to back up, this is how I remembered subjective versus objective complaints. Subjective complaints are what somebody says. I have a headache, I have neck pain. Those are subjective complaints. Objective is what we can measure and actually find and document. So it's data-driven compared to what somebody says. I just wanted to cover that. But let's talk about the CBIM framework. So the first is clinical. So when you walk in, the doctor is going to do an exam. One of the first steps of our TBI protocol, step 1, is the Rivermead or Stanford Post-Concussion Questionnaire. They're just circling numbers of symptoms, headaches, neck pain, anxiety, irritability, 0 or 4 if really severe. And that's the first step. So it could be balance problems, light sensitivity, cognitive complaints, confusion, amnesia. So you're just doing a clinical workup. And part of that clinical workup, you can do some objective testing. My clients use this. Well, let's talk about TBI for just a second from a really high level. Okay, so let's just talk about a car accident. You can go to the ER and, like you said, have an MRI, CT scan, have imaging, and that is one of the pillars, the I, CBIM, imaging. But sometimes imaging shows structural damage to the brain, but people may not have structural damage to their brain. They may have cognitive and behavioral impairments after a brain injury, and those are not going to show up on film. So the clinical part, physical exam, you're taking notes of what the patient is saying, and we can do some cognitive and behavioral impairment tests. We use the IMPACT test. It is an FDA-cleared test. Patient takes in the office on a computer. You do not need to purchase any machinery or devices. You don't need any of that. They take it on a computer in your office. In a personal injury case, not at home, because in a deposition, they can go, well, how do you know your patient took the test? How do you know cousin Sally or Aunt Judy took the test? So it'll be thrown out. So it's got to be in your office so you can proctor it. And that cognitive test, we also have it interpreted by a medical neuropsychologist, and that's really important. In a med legal case, you have to have an FDA-cleared test interpreted by the proper specialist for it to hold up in court. So that's clinical. Your physical exam, some objective testing like an IMPACT test. There's other cognitive screening tests out there like CRAO, SportGate, CNS vital signs. They're all relatively the same, according to a neurologist that helped me set up this TBI protocol. And something else that we can do clinically is finding oculomotor deficits, eye movements that are abnormal. So we can measure those eye movements, horizontal saccades, vertical saccades, circular, smooth pursuits, fixation, stability. Oculomotor impairments are the number one symptom of a possible brain injury. That comes from this neurologist that interprets some of our tests. That's right out of his mouth. So that's the clinical pillar. So you got clinical, we have imaging, and then we can also move into the B biomarkers. So there's a lab that my group typically works with, and they found 4 blood biomarkers that spike right after a brain injury. However, one of these blood biomarkers is called neurofilament light chain. Weeks and months after the trauma, it continues to go up. So if this particular biomarker shows up in the blood after an impact to the brain, it's a confirmation test that a TBI has occurred. That's where the technology is. It shows up in a blood test, specific blood test, to track these 4 blood biomarkers. And then finally, the last is the M of the CBIM pillar, modifiers, right? Modifiers can be variables of the patient, the age of the patient. Do they have ADHD, pre-existing psychiatric conditions, sleep disorders? What medications are they on? Do they have a history of substance abuse? So modifiers can really impact if this person has had a TBI. So 2 people can have the exact same injury and the exact same crash, but one person can have a lot of symptoms and some problems, and the other person may not, based on those modifiers. So wrapping this all up, Craig, I know that's the CBIM framework that the National Institute for Health has released. CBIM, clinical biomarkers, imaging, and modifiers.
Okay.
I know there was a lot to unpack.
Yeah, there's a lot. There's a lot. So what you were saying also about modifiers, what if somebody had a prior TBI?
Okay. Again, from the personal injury world, this is a question that we get in depositions. Here's how you kill it. Now, the neurologist that will do a deposition, if he interpreted the results, he loves that question because he will eat. So here's how he answers that question. Show me any objective evidence of imaging from before this particular accident. Did they go to the doctor? Did they complain of any of these? Is there any documented evidence of this injury prior to this current injury? And if there's no prior, doctor's visits or medical notes, well, rest assured you can rely that the brain injury happened because of this current accident, if that makes sense. Like,
right.
People can say, well, how do you know it happened because of this? Well, show me some documentation that it happened at another time.
Right. So, but getting back to, if somebody did have a prior TBI, let's say they were playing soccer 5-6 years ago and they were young, and then they later had a car accident and they had another TBI. That person might have more symptoms, right, than the person that never had any type of brain injury.
Yeah, true. We get this comes up a lot. Like, you hear in the NFL and sports leagues and hockey, people have concussions, but they're not traveling at 50 miles an hour. If you're T-boned, the shearing forces horizontally and vertically can be different in a car accident compared to a sporting event. So even you hear these athletes go into a TBI protocol, and they're maybe 2 weeks, maybe 3 weeks, and they're cleared to play. Just the volume and the speed of the impacts can differ when you're talking about car accidents compared to athletes in the playing field.
Okay,
that makes sense.
Yeah, definitely makes sense. So let's kind of, in your experience, let's unpack some of this, because we talked about initially what happens when a person has a head injury. Initially, just for some of the viewers out there and listeners, what are some of the symptoms people have, and what should people, in your experience, do after they think they've had a head injury? What are some of the things that they'll experience, and then also what should they do first off?
Yeah, well, go get checked by either your chiropractor, your family doctor. I mean, go get an opinion from a professional. And typical symptoms, like I said, obviously loss of consciousness is going to be a main one, but amnesia, confusion, irritability, loss of sleep, headache, dizziness, light sensitivity to light, maybe some cognitive complaints. But sometimes it's also good to talk to family members of people that are in a car accident or that have had a possible traumatic brain injury. Because if you just talk to the patient who had the trauma can say, "I'm totally fine. Everything's good." But then you talk to the wife, they go, "Well, he's not good. He woke up yesterday and put his full suit on to go to work. It was Saturday."
Right.
Or he woke up in the middle of the night and went to the bathroom.
Right.
In the closet.
Yeah.
right? So
And
obviously,
he didn't have anything to drink.
well, and he took a left turn instead of a right turn to go to the bathroom and ended up going in the closet. But so these are some of the things. It's not just interviewing the patient, but interviewing. The doctor can talk to family members and even coworkers to determine if a person is having cognitive impairments after a car accident. Because again, those do not show up on imaging. Right? That's why they have this 4-pillar model now. And then in terms of a personal injury case, I know we don't want to talk about personal injury, but it's important to me because it's my ecosystem. The more objective evidence that you can provide for this patient gives them a better, deeper level of diagnostics and care. It helps the attorney get this person's medical bills paid for and possible future medicals, because a traumatic brain injury, it doesn't heal in 90 days like a typical sprain strain after a car accident. Those symptoms can last for years, cause early onset dementia, Parkinson's, Alzheimer's disease. So the key is to get a diagnosis early. And then, as a chiropractor, we don't treat a TBI. We can refer that to a neurologist. They'll have all this information, all the data, so that they can provide better care for that person who suffered a TBI.
I thought what was great about your program was what you just said. You, as a chiropractor, we might not treat the TBI, but I think it's important to be able to screen for this. And I do think, unfortunately, there are a lot of times where people are in accidents and do have a TBI, and there's no river mean assessment that's done. There is no cranial nerve check by the doctor, and there's no impact test like what you were talking about before. So somebody is in an accident and they go to a primary care doctor or they go to a chiropractor, just from what I just had mentioned, is there anything else that it would be great for them to get screened to see if they need a more in-depth evaluation?
Yeah, well, let's just really keep it simple, right? Because in the past, people would go to the emergency room, they're going to do imaging, they're going to look for brain bleeds, severe lesions in the brain. But again, TBIs can happen on a microscopic level, and it's not going to show up on film. And just the public doesn't know what to do. So that's why I'm trying to educate the doctors that are in my program that provide this service for your patients, especially after a car accident, because 56% of this diagnosis is missed in emergency rooms, and 50% of those people don't follow up with care. And they can have symptoms later on that can turn into cognitive deficits, early onset dementia, Parkinson's, Alzheimer's disease, like I said in the past. So you just get checked.
Right.
Just get checked. Like, those symptoms are real. You're not imagining them, and there could be a underlying problem. And the sooner that you can get a diagnosis of that underlying problem, the faster you can get treated, so that you don't, the less likelihood of having those chronic diseases that can come from a traumatic brain injury.
Okay, great. So if someone is in an accident, they go to the ER and they have imaging, and their experience and the imaging came out negative. They just like what you said. They said everything is fine, or at least that's what they had told them. And they experience headaches in 2 weeks from the accident, and they experience them. They feel differently. They can't sleep as well. Maybe they have ringing in the ear, or they're having some other changes, memory issues, some different things. It's definitely important to get checked out, because you might not link the car accident to some of these other changes. So it's important. A concussion can affect a person, not necessarily the way a herniated disc, which is another type of injury in the neck or the back, where you might have consistent pain in your neck, you might have pain down your arm, you might have weakness in your arm, you might have numbness in your arm or leg. So the concussion is missed a lot because it's not as obvious. The signs and symptoms are not sometimes as obvious unless somebody is unconscious or it is very serious. So that's what we're trying to do today, is shed light on some of these other type of injuries that go undiagnosed. They don't go treated, And then they affect people in a lot of different ways. It could be maybe they get fired from their job because they're not as productive at work. They can't sleep. Maybe they have, they're suffering with headaches that they don't know why all of a sudden they have headaches. So these are important for our listeners out there to recognize.
Yeah. Can I interject something?
Yeah,
here?
yeah.
Yeah, because like you were saying, neuroinflammation evolves, meaning if you have a brain injury, it may take 24 to 72 hours before you have symptoms because neuroinflammation evolves. You can walk away from an accident feeling fine and wake up days later feeling foggy, nauseous, confused, and that could be a sign of a brain injury. So you heard this before. People say, well, it's just a mild TBI. Well, it's only mild if it's not yours.
Exactly.
Right? It's like being a little pregnant, right? Your brain is either injured or it isn't. But a mild TBI really just refers to the initial presentation. It doesn't reflect the long-term impact of
Right.
it. So even though that's a mild TBI, that may be talking about the symptoms like right now, but it can evolve into something more long-term if not handled early.
Yeah, excellent. Now, for people out there, if they know anyone, or maybe they're in the legal profession and they want to learn, who should, if a person is injured, what type of chiropractor or healthcare provider should they go to? What should they look for? Should they call their office and ask certain questions?
Absolutely. I mean, even your chiropractor, you can ask them, do you screen for traumatic brain injury at your office? Yeah, not every chiropractor has the training. Not everybody knows how to screen for traumatic brain injury. So yeah, ask questions. Just real quick, I had 2 friends that had heart attacks, and you have to take responsibility for your own health because no one's coming to save you. I had 2 friends that had heart attacks. I went to go visit them, and they said, Mark, had you ever had a calcium score? Okay, I know we're going off topic, but what I'm saying is, no, I never heard of that. So I talked to my primary, and I said, should I get a calcium score? And they said, yeah, that would be a great idea. But he didn't tell me because it's $90 for the test. And people get mad when doctors say, you got to have this test, but it's going to be an additional cost. Well, I had a calcium score, no symptoms, led to echocardiogram, CT scan on my chest. They found blockages and ended up having a stent put in. I had no symptoms, by the way. But I had to take control of my own health and make my own decisions based on information that was shared with me. This is going to sound weird. Thankfully, they had heart attacks. Right, that sounds terrible. But because of their experience and I had conversations with them, they could have saved my life.
Right.
Okay, so ask questions, right? Like, do you screen for traumatic brain injury? I'm having some symptoms and I need to know what is the root cause of those symptoms. Do you screen for TBI? What is your screening process, right? Neurologists can look at imaging and make diagnoses from imaging, but a neurologist isn't going to really do anything with cognitive and behavioral impacts. That's a medical neuropsychologist who's going to evaluate like the impact cognitive screening test because that is the proper specialist that handles those types of injuries.
So let's unpack let's unpack that because that's for somebody out there, they might not understand what a neurologist does in helping to treat somebody that had a concussion and what a neuropsychologist does.
Yeah. Well, a neuropsychologist is not going to look at an MRI or a CT scan. It's like reading Chinese for them. That's not their lane. They deal with cognitive and behavioral issues. That's what a neuropsychologist is. Thank you. A neurologist is going to treat brain and spinal conditions, look at MRIs. Maybe they do surgery or whatever a neurologist does to treat the actual problem, right? So, in a chiropractic office, the guys the guys and gals that have my TBI protocol, we do all these tests, like a right eye test to track oculomotor deficits, the impact test for cognitive and behavioral deficits, and then we get them telemedicine visits with a proper specialist. In the case of the impact test, the cognitive test, we get them a telemedicine visit with a medical neuropsychologist to assess the test, talk to the patient, and write the report. And for the oculomotor test, we have that assessed by a neurologist with experience. I mean, the one we use has been working with the NFL for 20 years in their concussion protocol, and he interprets our oculomotor test. So, and that meets a med-legal Daubert standard in most states, an FDA-cleared screening test interpreted by the proper medical specialist. So I know most people aren't going to go out there and look for medical neuropsychologists, but start at your chiropractic office, your general practitioner, whoever, ask them questions and make sure you're getting a cognitive screening test, even if your imaging says normal.
Yeah, I like that story that you brought up. Sorry you had to have a stent and everything like that.
It was
But
the easiest procedures. The biggest joke was fine. I think I had pizza right after.
oh my gosh. But it's important to note, if you have to take responsibility for your health, it's important to ask questions. If you go to a chiropractor or a physical therapist, your family medical doctor, or anyone, and you're having complaints, you need to let them know. I tell my patients before they go see specialists to make a list of questions that they have before they see the specialist, because sometimes they wait in a medical office for 30 minutes or 45 minutes or an hour. They see the doctor and it might be 15 minutes, 10, 15 minutes, and they forgot to ask them certain questions, or they forgot to let them know, hey doc, I don't know why, but all of a sudden now I'm starting to cry, or I can't get up out of bed. I'm just so drowsy all the time. Does this have anything to do with it? So that's important. Asking questions and taking responsibility for your health. That's going to make a difference. And unfortunately, not every provider is trained to screen for concussion, aka TBI, traumatic brain injury. So it's important that you ask questions to make sure that you're going to the right provider. Some providers, they might not focus in that area. They might focus on other type of conditions, and they might just kind of gloss over these type of conditions. And for many years, when I first came out of school almost 30 years ago, we didn't know a lot of this stuff, and there's some providers out there that they might not keep up on all the latest information regarding new treatment, new diagnosis, or new screenings for different conditions that patients might have. So very important to ask questions and to make sure you're going to the right person. If you're having a condition and it doesn't seem like they are addressing it, you might unfortunately need to see someone else. So that's essential, because you want to get these conditions documented, diagnosed, and treated as soon as possible. Because if you're doing certain activities, let's say somebody has a concussion and they're working out in the gym like they usually did, or they're drinking alcohol a lot, and maybe they used to drink and they're drinking the same. They haven't changed any behaviors. This condition could get worse.
Yeah. So you asked earlier, what should someone do after an accident? Okay. So I'll just give you this list of 8 things that they can do. A detailed clinical evaluation. Physician, chiropractor, get it. Cognitive testing, right? With an FDA cleared test interpreted by the proper specialist. Vestibular or oculomotor screening. That's,
checking the eyes.
Right. If they're tracking horizontally, if they're tracking vertically smoothly, circular smooth pursuits, fixation stability. These can all be tested with a computer. It fires into their eyes. You follow this little ball back and forth, this way, this way, this way. And then we have it interpreted by a neurologist. And consider biomarkers. Like this one lab out in Texas called Clear TBI is the one lab that I know of that has the CLIA clearance to test for these 4 biomarkers.
And that's blood work.
Blood work. Yeah.
Blood work.
That's right. Escalate to imaging if there's red flags. Like you should have imaging anyway after a car accident. MRI, CT scan, NeuroQuant shows some brain mapping. It's another type of kind of like an MRI. And then document the modifiers, like the age, because modifiers are the risk factors. Prior history of concussion, substance abuse problems, psychiatric disorders, just demographics of the person can play an impact too. Then what I kind of want to close with here, talking about a brain injury, the brain doesn't bruise like a knee when it's injured. The injuries happen in a microscopic and biochemical level. So the CBIM framework helps us see what used to be invisible through the blood biomarkers, through cognitive impairments. So the future of TBI diagnosis isn't just one test. It's integrating all these things to tell a story, imaging for structural deficits, cognitive impairments for cognitive and behavioral impairments, oculomotor, vestibular impairments, and then finally the blood biomarkers. So when you line up all of these objective evidence, this is actually data. whether you get it in a chiropractic office or a physician's office. And a neurologist told me this. He goes, Mark, it doesn't matter. The data is the data, right? The data isn't going to change. It just has to be interpreted by the proper person in a personal injury standpoint and a med legal standpoint to hold up in court. But again, the data is the data. Once you have that data, the neurologist will know how to get it treated. It's not guesswork anymore because of this new pillar framework, the CBIM framework.
Okay, Mark.
Yes.
Are all MRIs created equal?
No. There's different MRI technology. I mean, there's regular MRI. There's now one called a DTI, which is you do it in an MRI machine, but it shows brain mapping in a way. There's a neuroquant, another type of imaging. So not all MRIs are created equal. So ask your specialist, which is the right one for you, depending on your injury.
So you mean to tell me somebody can have an MRI in a hospital, and they can later have another MRI that's a different type of MRI, and it can now show injuries, or it could show some objective signs of a brain injury?
Correct. The DTI, like diffuse tensor imaging, it'll show breakages in this mapping, and that's structural damage, and that just doesn't show up in a standard MRI.
Right. So that's, folks, if you've gotten an MRI, it might not have been the MRI. There are differences in MRIs. There are different type of MRI studies that could be done on the brain. One might not show any sign of an injury, and another one will show sign of an injury. So it's important that you go to the right doctor and they order the right test. When you go to a hospital, their objective is to one, assess, is the patient's life in jeopardy? Okay, they're going to do everything they need to do to make sure that the patient is not going to die. That's their main objective. These other type of tests that are more nuanced, they're not going to necessarily do these tests on somebody because they're looking for those emergency type of conditions that can lead to death. So that's very important. You talked about blood work. How recent have people been using biomarkers or doing blood work and seeing changes in blood work to show that there's been a brain injury?
Sure. Well, in the past, there's been some blood tests, and they only really track 2 biomarkers, and they would spike really early right after the accident and then come down really fast in a few days. But then they found this one called neurofilament light chain. That particular blood biomarker continued to rise evenly weeks and months after that trauma. So when you have this blood biomarker test, and I only know of one lab that does it out of Texas, Clear TBI, that tracks these 4 blood biomarkers, but specifically the neurofilament light chain, it is a confirmation test that in the brain there's been biochemical and cellular damage that now shows up in the blood from these biomarkers.
Wow. And that's a special test. So you can go to your family practitioner, your family doctor, and you can have blood work, but if they don't specifically test for this, they wouldn't know that you had that brain injury. And how new is this? This is new. This wasn't being done 3-4 years ago, correct?
No. Clear TBI just got their CLIA certification for their lab to do this test in 2025. So this is rapidly changing. All this technology is really new, and it's really exciting. But according to this neurologist that reads our labs and reads our, some of our neurological testing that we do, he said in 5 years, this will be the gold standard in traumatic brain injury diagnostics, the blood biomarkers.
Right. This is great. I'm excited that they're developing these new objective tests, because some people that suffer with TBI, traumatic brain injury, they are told, oh, it's in your head, or
it is.
Yeah, it is. I know. But in terms of that, I'm talking about people are making it up, or it's due to something else. It's due to stress, or hereditary, and there's just nothing they can do about it. So to be able to have different type of imaging that's specific for showing brain injury to have specific type of blood tests that show that there is impairment, there is injury in a brain injury is refreshing, because it gives people hope that their condition will be diagnosed properly, and then maybe they can get some treatment. So I know, again, we're going to go beyond the chiropractic scope here, but from what you know of, what are some new treatments that are coming out? So that are developing now that you think will be more mainstream, or people might be able to get treatment for traumatic brain injury, concussion?
Listen, Craig, fair question. I'm a chiropractor. I'm going to stay in my lane. I'm only doing the diagnostics. We refer this out to a proper specialist once we get some objective evidence that a brain injury happened to occur. But what I will share, and this is just for individuals, here's what I really want you to take away and remember. Don't ignore delayed symptoms. Normal CT scans and MRI does not rule out concussion. You need other objective tests, because cognitive impairments, behavioral impairments, those don't show up on film, right? They have to be interpreted by a proper specialist. Early documentation matters, and so advocate for proper screening. Now, for professionals out there, chiropractors, interventional pain doctors, if you're a provider and you're treating these patients who may have had a TBI, stop relying on subjective complaints alone. Like you said, I got headaches, neck pain, back pain. Those are just subjective. The patient can say that. I'm not saying that the patient is lying, or like you said, it's in your head, but the objective evidence is what's going to nail down the diagnosis. Objective testing strengthens the diagnosis. Early detection reduces long-term consequences. And this multi-pillar documentation approach through the CBIM pillars strengthens clinical clarity. And that's what we need. We need to get a clear picture of what's happening with this patient with these 4 pillars of TBI diagnostics: the clinical, the biomarkers, the imaging, and the modifiers.
Great. And I was always trained in school that you order diagnostic testing to be able to, 1, come up with an appropriate diagnosis, and 2, that you're going to take that information and be able to hopefully treat the patient appropriately for that specific type of condition, because there might be 20 ways to treat somebody that has neck pain. And when you do, let's say, an MRI, and you see that there's a certain herniation, or that there's not a herniation, or that there's something else, there's other things that you can do to help that patient. So appropriate diagnostic testing helps in treatment, in giving the doctor the data so they can come up with a treatment program that's appropriate for the patient. I know we're going to go beyond chiropractic, but are there medications that some neurologists are using to help people with some of these injuries and help overcome some of the long-term effects?
Again, I stay in my lane.
I know.
I don't want to say what neurologists do, what they don't do, because again, that's not my scope. I really want to just talk about the diagnostic part of it. And then, with my doctors and chiropractors are doing the screening test, we make a proper referral based on the objective evidence, right? Prescription without diagnosis is malpractice. We don't just prescribe a treatment plan for someone without the objective evidence that tells the story that the treatment is warranted, right? It has to be medically necessary. So medications, the treatments that neurologists do, I really focus on what chiropractors can do, because those are my ideal clients. That's who I really help. I also help other orthopedic surgeons, non-surgical orthopedic surgeons, interventional pain doctors, and just people that want to treat these types of injuries. I can help you market for these people, screen them, and get them the care that they really need. And I got to tell you, man, I talk to a lot of chiropractors, and I ask them, do you have a TBI protocol? Are you screening for traumatic brain injury? And they go, yeah, well, we ask them if they have any symptoms, and that's just not enough. And you're doing the patient a disservice if you're not screening for TBI, especially after a car accident.
Yeah, I agree. I think it goes undiagnosed, and unfortunately, there's not as much training in this particular area in the schools at this point, and a lot of doctors are out there, and just it's just something that they don't know. It gets missed, and then the patient goes undiagnosed and can't get the right treatment.
We're on the cutting edge right now because the NIH, National Institute for Health, just released this new pillar framework. There's no lab test to track these biomarkers. I mean, we're on the cutting edge right now in 2025 and 2026. And again, if you're not screening for this, the tools are out there. You just got to understand, what they are, how they work, and implement them in your practice if you're a provider. And if you've been in a car accident, ask your doctor questions. Do I have a TBI? Even though my MRI or my CT scan was negative, what else can we do? Because I'm still having complications. I'm still having symptoms, and I really want to get to the root of this.
Great. Awesome. Mark, this has been really awesome episode, learning about some new protocols and I guess a new system to be able to classify TBI. I mean, this blood work, these biomarkers, to be able to have blood work to tell somebody, okay, you could take a blood test, and then from the blood work, you could be able to diagnose a brain injury. I mean, that's just amazing. And so many people don't know about that. So that's...
Well, think of the biomarkers as a confirmation test. After there's all these other objective evidence that there's a brain injury.
Right. It's not standalone. I'm not saying that in itself,
no,
but if they have the other type of findings that this, like what you're saying.
What I'm saying is, if somebody thinks they have a brain injury, don't go right to the blood test, because it really is a confirmation test. Do some other objective tests first. Tell a story. Looks like this person really did have a TBI, and if those biomarkers are present in the blood, 99% confirmation that they're most likely a TBI has occurred.
Great. Awesome. So we are coming to the end of our show, and at the end of our show, we have a ritual. We have a gift for our guests. At the end of the show, we give away tumblers that are superhero tumblers, and they signify to us comeback. The superheroes each have a power, and they have resilience and strength. And we also do have a university one that I think you might like as well. So behind you, there are a couple of tumblers, and wanted to present you with one of these. We have the Gators, we have Captain America, we have Batman, we have Deadpool, Superman, and Hulk. Which one speaks to you the most?
Well, based on my history, I am going to grab, let's just do this really quick. We're going to take the Florida Gators tumbler. I went to the University of Florida 100 years ago, and I actually moved back to Florida a year ago. My wife and I were empty nesters. I'll put this right here. Let's support the Gators. We became empty nesters. Our kids are off at college, and we both have computer jobs. I stare at a computer all day. I said, let's try to move to Florida. So we did it, and February 1st has been 12 months since we moved down here. So we love it.
Awesome. Well, welcome here. And also, if somebody wants to get in touch with you, let's say they're a chiropractor or a health provider, what's the best way to contact you?
Sure. Well, my company is called Prime Spine Consulting. You can go to primespineconsulting.com. You can go to drmarkslater.com, Mark with a K, and you can get information about my company there. But what I really do is I help providers, whether you're a chiropractor, orthopedic surgeon, neurologist, and you want PI patients, I can help you scale your PI practice with automation, reaching out to hundreds of attorneys per week, automating messages to them, getting them to respond. I can help you hire, train, coach, optimize, and track a dedicated PI marketing liaison specifically for your practice. Listen, personal injury is all about relationships. Show me the doctor with more relationships with providers and attorneys in your market. I'll show you the busiest doctor in town. It's all about relationships and personal injury. And that's kind of, I don't help chiropractors get commercial insurance patients, cash patients, Medicare, Medicaid patients. If you want personal injury patients and you just want to talk, you can go to my website, book a 15-minute phone call. It's not a sales call, just a chat. What you're doing, what's working, what's not working, and then I'll talk about some things that can help you grow your personal injury patient base.
What I liked about your program, Mark, was you helped me understand and develop a TBI protocol in my office. I wanted to learn more about that, and I did. Because the relationships are really important, like what you were talking about. But if you're a provider, ultimately you want to do a better job. You want to be able to identify these other conditions to be able to help more people. And in Mark's program, I really learned she shed light on a lot of new information, which helped me, put me on a trajectory to learn more about different conditions so I can be a better provider and be able to screen and identify conditions that much better for patients, helping diagnose and helping patients as best I could, or being able to make sure that I'm sending them and referring them out when it's appropriate. So thank you very much for watching today. And if you have any questions, please write them in the comments below. And like I say every week, like, follow, subscribe. See you on the other side.